Talksafe is a framework to help us look at how we can further improve our safety for patients within our organisation. We all know that at least 1 in 10 patients is harmed across the NHS every day from routine things that can go wrong, often very small slips in procedure, not following policy, and particularly when we work as part of a large team, not looking out for each other and pulling each other up when things might go wrong.
I was sceptical about Talksafe at first. I thought it was just another initiative that the hospital had brought in. And then I went and I had the training with JMC, and it really struck home with me that it could be a positive way to change the safety culture within the hospital. And I've used it quite a lot. I've spoken to people in the lab about areas where there is potential for patient harms, and we've discussed it, used the coaching culture of the Talksafe, and people who I have spoken to have actually changed their practice and now working on safe ways. In the area that I work, a small error can have a really big consequence, especially in patient identification. If you make an error in that, then it can have a big consequence for the patient.
I want us to have a me test organisation. By that I mean that if we do any test or procedure or investigation for a patient, we ask ourselves, is that what I would want to happen to me? And I believe that if the answer to the question is no, we're probably doing the wrong thing.
Talksafe helps us to frame a safety conversation with each other. It's about one-on-one conversation using a specific 9-step framework that helps us to engage in a dialogue with each other. So for example, if I was in a clinical area and I saw that a clinician wasn't washing their hands and following the 5 moments of hand hygiene, what do? Do I just turn a blind eye and walk away? Or do I engage in a conversation with that clinician and helping them to see where they've actually carried out an unsafe act in not washing their hands? And the Talksafe conversation isn't about telling somebody off, it's not about punishment, but it really is about having a two-way conversation about how we could have made that situation safer. And particularly if I'd engaged in that conversation with that clinician who hasn't followed the 5 moments of hand hygiene, framing the conversation in such a way that we end our discussion with a commitment to act, so that the clinician understands the importance of washing their hands, as an example. So SUSA, or Talksafe, so looking at safe and unsafe acts, is a culture that we want to develop as part of our safety improvement work within the organisation. We know that we've made great improvements in reducing harm to our patients. If we just look at our infection prevention standards around MRSA and Clostridium difficile, we've seen fantastic improvements by doing things right every time for our patients. So Talksafe is about further developing our safety culture and not being afraid to have those discussions with each other.
Conversely, if practice is seen to be good, then that will be praised and reinforced and hopefully extended to other members of staff. So I hope that all members of staff will engage actively in Talksafe and regard it as a way of driving up the care that we give to our patients in a better, safer way.